The human hand is a marvel of engineering, often taken for granted. That is, until it's injured or afflicted with arthritis. We spoke with Dr. Stephen O'Connell of the Desert Orthopedic Center in Rancho Mirage about some of the latest surgical advancements.
Hand surgery combines a lot of surgical specialties. We do surgery on the tendons, nerves, bone surgery, microsurgery, replantation of amputated extremities, and joint replacements. So we do a little bit of everything and then combine those orthopedic surgical specialty talents with those of others, such as plastic surgery. Since the hand is one of the most commonly injured parts of the body, trauma is a very large part of my practice. Certainly we're using our hands to lift, grab things, work. Repetitive motion or strenuous use of the hand can often lead to traumatic events. And then certainly there's just falls and traumatic injuries from a construction worker. Fractures, tendon injuries, lacerations are very common, and then they must be dealt with. Different than other injuries, many hand injuries need to be treated urgently, because frequently hand injuries are open injuries. And what I mean by that, meaning a laceration so that the tendon, the nerve, or the bone are open from a traumatic injury and laceration. Those injuries had to be cleaned, irrigated out to prevent infection. Those bones need to be stabilized to stabilize the structural integrity of the hand, and then the tendons and nerves repaired appropriately, and oftentimes that requires microscopic intervention in the form of replantations or nerve injuries. When it comes to disease of the hand, probably the most common that I see is arthritis, and that comes in a variety of forms, whether it be a rheumatological problem such as rheumatoid arthritis or psoriatic arthritis, or just our common osteoarthritis. And then certainly the arthritis that may present after a trauma, traumatic arthritis, may all present as deformed or painful extremities, finger joints, wrist joints, elbows, shoulders, all that may be painful with limited motion and decreased function. So that reconstruction of that arthritic joint could possibly include treatment with just anti-inflammatory medications and therapy. Sometimes certain splinting protocols can correct a deformity or provide better function for a patient and better comfort. And if not, then there's certainly a myriad of surgical options. As in many areas of medicine, there are new technologies developing all the time. In orthopedics and in hand surgery especially, there are some exciting things happening. For one, joint replacement. New joints have come out in which I'm putting in my patients now that actually are like little mini joint replacements of the knee. They're made of pyrocarbon, and they anatomically reproduce the anatomic structural integrity of the joint. Also, the material's exciting. Pyrocarbon has almost the exact modulus elasticity as cortical bone, much, much closer than the typical metals or titanium that are used in other joint replacements. So it's an exciting new part of joint replacement surgery in the hand to have a material so compatible with bone and also give us great structural integrity. The result is going to be patients with better stability, less pain, and better function.